Hello, everyone. I'm Dr. Hesselton with Cornerstone Care. I'm joined today with Dr. Allison and Dr. Ibrahim. We're coming up on Men's Health Month, and we wanted to give an opportunity to talk about different health concerns, specifically as it relates to men. So, gentlemen, thanks for being here. Let's go ahead and have a little conversation here. Kind of as we were preparing for this, I was looking at statistics when we talk about men's health. 45% of men age 18 and older have not visited their doctor for an annual checkup. This is all from a study from April of 2021. 84% of men just don't go to the doctor about a specific concern if they have one at any one point during a year. Although 90% of men say they live pretty much a healthy lifestyle, the reality is, as we kind of saw, most don't follow up with the doctor on a regular basis. And only 1/3 actually agreed that they felt well informed about their general health and what things they should be doing. And then the one I found kind of interesting, it's 56% of men said they really only went to the doctor when their significant other told them, hey, it's time to go, you need to go be seen. So, from your perspective, how important is it for men to show up and kind of do this routine maintenance screening?
Yeah, I think going to the doctor's office is the best thing you can do, obviously. If we don't see you, we don't interact with you, don't do a physical exam, then we can't identify those problems that you may not even be aware that you have in the first place.
Absolutely. And it becomes very important for men to, there are certain health problems that men are specifically more at risk for that we need to address at certain times throughout their life. From your experience, Dr. Ibrahim, when you are talking to men in general in the clinic who generally haven't been seen for a while, what are some things that you look for as far as like health problems that you focus in on for screening and prevention?
We usually start with a basic conversation. We go over some lifestyle factors that they have. For example, if they're smoking, we talk deeply about how we can get them to quit smoking. We ask about their diet, how much exercise they're getting in a week. We tend to go over their family history. So if there's a lot of family disease that runs in the family, we like to hop on that and address them quite quickly. A lot of the patients are scared about blood work, for example. We tend to do blood work maybe once or twice maximum a year. So that's not something they should be really concerned about. And I like to tell them that if there's something wrong, I rather identify it early rather than later on, just so we can make sure that everything is taken care of when we check off all the boxes.
Absolutely. You mentioned a really important point is really one of the big things about family medicine is our goal is to prevent problems before they become really big problems. So if we can catch stuff early, it helps us out a lot just to kind of look for their general well-being and general health going forward.
Absolutely, yes.
So as we kind of look at men in general, I have the statistics here from the CDC on kind of the most common causes of death and mortality in men. Number one, and has been for years, is cardiovascular health. So diseases of the heart attack, stroke. We talk about atherosclerosis or hardening of the arteries. When we kind of look at that, over half of men have hypertension. And obviously, if they're not coming to the doctor, they're not being seen and not being treated for that. We also have about half of men who don't get enough activity on a regular basis. I can be the first to say, me too. And then over 40% of men ages 20 and over are obese, which all kind of play a role into cardiovascular health. What other things, other than cardiovascular health, are really big concerns for men when you see them in the clinic?
I would say one of the biggest things it would be tobacco use
Okay.
is very big. Smoking and a lot of chewing tobacco as well. See a lot of people with chronic lung disease because they've been smoking for a very long time, a lot of oral disease, gum disease, and obviously things like cancer, lung cancer, mouth cancer, that could easily be prevented if we could intervene early to cut down or stop tobacco use.
Absolutely. So you mentioned smoking. As I'm kind of looking at my little statistics here, lung disease, lower respiratory diseases like COPD and things like that, that is number 5 on the most common causes of mortality and morbidity in male population. If we go to most common causes of death nationwide, cancers are right at number 2. And smoking is a huge risk factor for a ton of different types of cancer, not just lung cancer. You mentioned oral cancer as well. Bladder cancer is also on that list. So definitely those kind of preventative things are things we want to be talking about when we see patients on a regular basis. Well, I wanted to kind of mention, because this is something I know I personally have a lot of men that come and talk to me about. It's the prostate cancer screening. For some reason, it's definitely one of those things that men sit there and go, I'm not sure I want this done. And there is a purpose for prostate cancer screening. But it may not be the right move for absolutely everyone. So how do you kind of, Dr. Ibrahim, discuss prostate cancer screening with your patients?
A lot of patients tend to get scared that I'm going to examine their prostate, just that being the only way that I could identify prostate cancer. That's not necessarily the case. We do recommend a prostate exam, but if you're not comfortable with that, we do blood testing as well. And really, based on that number and a lot of different risk factors, we can determine if you have a high risk for prostate cancer. If your father or grandfather or someone else in the family had prostate cancer, then we need to focus on that a little bit more, just to make sure that everything is taken care of. And especially if you're having a lot of symptoms, for example, you're losing weight and we can't explain why, or you're bleeding, or there's just some blood in your urine, then we need to address that and make sure you make an appointment with your doctor so we can take care of that for you.
Absolutely. So jumping over here, kind of, I did mention prostate cancer screening may not be the right step for everyone. What are the current recommendations for prostate cancer screening? Does everyone need to get that on a regular basis, or is it something that only if they're at high risk, or is it just something that, hey, let's have a conversation?
Yeah, it certainly is a conversation between the patient and the doctor, specifically based on age group as well. And like Dr. Ibrahim said, there are a lot of risk factors that may push us towards recommending prostate cancer more for some patients than others. So it's very important to have that conversation with the doctor. A lot of men age 55 to 70, we definitely talk about screening. And that is, again, a choice between the doctor and the patient. For those who have more risk factors, we may start earlier, as early as 40. So seeing your doctor, talking about it is the best thing you can do, so we can determine if that's right for you.
So thank you both for coming down and talking about this. This is a very important topic, especially this time of year when we're talking about men's health. Men as a whole generally don't go and see the doctor as often as we should. I can say even myself is guilty of this. So our encouragement this time of the year, and really any time of the year, is if you're a male, haven't been seen for a while, come down. Any concerns, we can actually get these screening tests done while you're here in clinic. And more than anything else, it's a chance for us to kind of discuss the different options for screenings and what tests need to be done, just to make sure that we optimize health for years going forward.